Nick Guldemond. I'm a professor of healthcare and public health. I'm working mainly on health systems transformation, mainly for policymakers and organizations at the public side, but also private side, and helping countries, regions, settings, and to transform healthcare to more person-centered, digitally enabled, integrated care for a variety of topics. Digital transformation in healthcare is particularly important because healthcare is very much an information-driven process. That applies to data for treating patients, having lab results, context of the patients, but also databases for research and knowledge about pharmaceuticals, about devices, the process of care, how information exchange is so much important for professionals to work with each other, to know what's the current status, to make decisions. At the level of authorities, it's important for policy making, for quality assurance and safety, and also for governments to do the sort of long-term planning, which is also data-driven, and this also should be supported by digitalization, because paper and pencil work in healthcare usually is not very suitable for that, and not in the last instance the role and information to patients. And also for this, it's very important that we inform patients about the situation, but especially if you're also thinking about lifestyle change behavior, giving advice not only to the patient but maybe also to relatives and other relevant carers. Information is quite critical to make a more preventive health style related sort of change. So you can see that data, information exchange is everywhere. So if of all sectors, healthcare is pretty pretty dense with data, and therefore relevant for digitalization. This more regional, local focus, where from different angles is looked at how can we improve healthcare, including the digital element. So it also takes a sort of more process and ecosystems perspective. So in healthcare, a lot is about improving processes rather than, let's say, single issues. It's very much dependent on the local context. So what kind of actors are working on healthcare? Like professionals, like companies, like authorities, supporting staff, and also the population, the citizens, the users of healthcare. We know from research, from evidence, that this sort of local context is really critical to improve healthcare services. And there are also there's a huge opportunity for solutions and for companies to help with to building these solutions, to integrate and implement. And also this might have a sort of local, regional benefit in terms of economic growth. So I think what's interesting in the project that there are different regions across Europe involved. And this makes it also that we have a variety of partners and different perspectives, which is interesting to learn from each other and exchange. It also translates outcomes which can be used in different settings, different countries, different cultures. And it addresses also the professionals, the entrepreneurs, the private sector, but also local policymakers. So this combination is really a successful one if we want to improve healthcare at a very local level. And obviously it's a European project. So we have the connection to what's happening on the European level, where, for example, European Health Data Space funding programs are promoted and supported. There are obviously national authorities involved, and then you have more the regional level. And this, I think, shows as a framework in the project which really works, what really helps, and which is really focused on implementation. I think this sort of regional orientation, this multi-stakeholder combination of professionals, companies, policymakers, and really impact and implementation focus is something we will see more often, which is will be more important. So I think for initiatives, for organizations, it's really critical that we are becoming more effective on making the change and transformation healthcare effective. And this is through this more, let's say, regional approach with different stakeholders. So I think the HealthChain project provides a lot of insights, lessons, use cases, which you can use as a sort of example, an approach to apply for yourself, and also be more successful. And also the network, the partners might also collaborate, are open to work with you to help you in making this approach successful.